All right, today we're jumping into a problem that is, well, just super frustrating. Heartburn that decides to make a comeback right in the middle of the night. We're going to be looking at a really clever next-gen medication that's designed to win that late-night battle, once and for all.
You know that feeling, right? You take your reflux medication, you feel totally fine all day, and then bam, you're jolted awake by that all-too-familiar burn. It's a super common frustration, and it perfectly sets the stage for the unique solution we're about to dive into.
So what are we really talking about here? The condition is often gastroesophageal reflux disease. You've probably heard it called GERD. If it goes on for a while, it can lead to something called erosive esophagitis, which is pretty much what it sounds like. The stomach acid starts to actually damage the lining of your esophagus. And while lots of standard treatments do work, they often have this one blind spot, making that relief last a full 24 hours. That late-night acid breakthrough, it's a huge issue for a lot of people.
And that is exactly where Dexlansoprazole comes into the picture. You might know it by brand names like Dexalant. This medication represents a whole different strategy for managing stomach acid, one that's designed specifically to close that gap in coverage.
Now, Dexlansoprazole belongs to a class of drugs you've probably heard of, proton pump inhibitors, or PPIs. But, and this is a big but, it has a trick up its sleeve. First though, let's do a super quick recap on what a PPI actually does. I want you to imagine your stomach is like a pot of soup that's always simmering. The parts of your stomach that make acid are called proton pumps. Think of them as the flame under the pot. All a PPI does is reach in and turn down that flame. It reduces the amount of acid your stomach is making in the first place. So yeah, it's a really direct way to get heartburn under control, right at the source. Okay, so if it's a PPI just like the others, what makes it so special? Well, the secret is all in its core technology, something called dual delayed release. This is not your standard one-and-done kind of medication. See, inside every single capsule, there are actually two different kinds of tiny little medicine granules. They're both engineered to do the exact same job, but here's the clever part. They're designed to dissolve at different times as they move through your body, and that is the absolute key to its long-lasting action. So here's how that two-wave attack is timed. About 1 to 2 hours after you take the pill, the first wave of granules dissolves, giving you that initial fast relief. But then 4 to 5 hours later, right around the time other medications might start to wear off, that second, larger wave of granules dissolves further down in your system, releasing another full blast of the drug. It's a planned, two-stage assault on stomach acid. Let's put it side by side. A standard PPI gives you one big peak of medicine in your system, and then it slowly fades away. Dexlansoprazole gives you two. That second peak is specifically designed to extend the acid control, making sure you're covered through the entire day and, crucially, through the entire night.
And look, this isn't just a cool theory. The clinical data really backs this up. This dual-release mechanism is directly tied to cutting down on those awful nighttime symptoms and the sleep problems they cause. I mean, for anyone who's been struggling with reflux waking them up, this can be a total game changer.
So the science is really cool, right? But how does that actually translate into a treatment plan? Let's take a look at how you actually use this medication. It's actually really simple. It's just a once-a-day pill. For general GERD or heartburn, the typical starting dose is 30 milligrams for about 4 weeks. Now, if there's more significant healing that needs to happen, doctors will often go with a 60 milligram dose for up to 8 weeks. And here's a nice little bonus. You can take it with or without food, which makes it super easy to fit into your daily routine. And here's something I think is really smart. The design has this thoughtful option for anyone who has a hard time swallowing pills. You can actually open up the capsule and sprinkle those little granules right onto a spoonful of applesauce. The key, though, is you have to swallow it right away, and you can't chew it. You got to keep that special dual-release coating on the granules intact. This kind of flexibility can make a huge difference in actually sticking with the treatment. Okay, of course, with any medicine, we absolutely have to talk about safety. So let's go over the potential side effects and the precautions you really need to know about. So the good news is, most people tolerate it really well. When side effects do pop up, they're usually pretty mild. Things like diarrhea, maybe some stomach pain, or nausea. Now, let's talk about long-term use. And honestly, this applies to PPIs as a whole. There are a few things that doctors keep an eye on. Using them for more than a year might be linked to a slightly higher risk of bone fractures, and it can sometimes affect how your body absorbs magnesium and vitamin B12. This is exactly why it's so important to only use these medications under a doctor's supervision. And that's why just being open and honest with your healthcare provider is absolutely key.
They need to know if you're pregnant or breastfeeding, if you have any liver issues, and it is crucial, really crucial, to tell them about every single other medication you're on, because some, like methotrexate, can have some serious interactions.
So after all of that, the big question is, who is the perfect candidate for this specific medication? Let's pull all the pieces together.
Dexlansoprazole really seems to shine for people dealing with stubborn, persistent GERD, and it's especially valuable for anyone who is just plagued by those nighttime symptoms that seem to break right through other treatments. So if your standard PPI hasn't given you that complete, around-the-clock relief, this dual-release technology might just be the answer you're looking for.
And that brings us to this one single number, 24. That is the goal. Not just 12 hours of relief, not 16, but smooth, consistent acid control around the clock, helping you work, eat, and most importantly, sleep without being interrupted by reflux.
So at the end of the day, this technology offers a really unique strategy in the fight against stubborn acid reflux. And it brings up a simple but pretty powerful question. If a single wave of relief just hasn't been enough for you, could a two-wave approach finally be the solution? Now that's a conversation definitely worth having with your doctor. Thanks for tuning in.
Hi there, forest friend. Thanks for clicking on our video. We're so happy you're here. Before we jump in, don't forget to like, subscribe, and share this video with your friends.